So here's something that I commonly meet in my clinical practice that may help you understand why psychotherapy takes time to work or to be effective. A client or a patient walks in with a specific problem in mind. The problem may be that they're not able to fall asleep, they're procrastinating, or they're binge eating, and they believe that that's the only problem they have. If you can solve it for them, if you can help them find a solution for it, then they're okay. And as you take your history in the first consultation, what you realize is that the sleep disturbance is actually just one symptom of the actual problem. And we know that a number of mental illnesses have sleep disturbance as a symptom. For example, depressive disorders, anxiety disorders, stressor and trauma-related disorders such as PTSD, adjustment disorders, OCD have sleep disturbance as a symptom, bipolar 2 especially, because you don't have the full manic episode. And so as you gather history, you start realizing that this patient may actually have a mental illness, and sleep is just one of the symptoms. And so the first session may not be sufficient because every session takes about 50 minutes. So the first session may not be sufficient for you to gather all the information. So you might not be able to get a diagnosis in the first session. You do the second one and you gather more information. And sometimes the patient may withhold information thinking that it's not important. They might have symptoms that they're experiencing that they don't think are bothersome or they're worth sharing with the psychiatrist. The second part may be that, especially the binge eating, a person may think that that's the problem, but that may be a maladaptive coping strategy that the person has developed to enable them to deal with the problem, with the actual problem. So you ask the patient, for example, when do you eat? And they'll tell you that I do 3 meals a day and I've reduced my portion in an effort to reduce the weight that I'm gaining. But then they forget that the snacking is also eating. So between the meals, they do a lot of snacking. They actually do more eating between the meals than during the meals. And so when you keep probing further and further, and remember these sessions last for only 50 minutes, and so you won't be able to get all of this information in one session. That's why there are many sessions that are required in psychotherapy. And the self-discovery journey usually begins when a person starts asking themselves, why do I need a chocolate bar like Snickers to feel better after being criticized? Why do I need to eat Twix just to feel comforted after I felt neglected or rejected? Why do I need to comfort myself with food after things are not going the way I want them to go, or I'm not feeling the way I want to feel? And so the sessions take time because even as the patient is trying to relay or convey these symptoms to the therapist, they don't come out as quickly or as clearly.